All right, let's talk about your business because there's a few things I want to talk about it. Body on Point out there in
Yeah.
downtown Houston. Let's go.
Yes.
So
Yes.
let's talk about your business. Like, what all do you do? What's your specialty there?
So my specialty is dry needling, and I'll say two things, like what it is and where it came from. So it looks like acupuncture. We use the same needles that acupuncturists use, but it's just used differently. So, while they are balancing energy systems and things like that, it may be more so, like this is the area that hurts. I know the muscles that control this area. I know the muscles that may be weakened by, I'm using the needles to facilitate whatever response I need. So it's a difference between, dry needling and acupuncture, but the similarity is the needle. I got into dry needling because I was always a heavy base manual therapist. Like during the session, I'm going to put my hands on you at some point just to try to see what I feel and figure it out, from a clinician standpoint. Once I had dry needling done on myself, I experienced a huge relief that nothing else was giving me as a physical therapist. So when it was time to renew my license, I said, well, let me get certified in something I actually enjoy and believe in instead of taking some crazy fluff classes
Yeah.
for some credits. And so once I actually started doing it, I started getting these crazy results. And so I'm like, this is like a little miracle drug for me. So that's why I kind of like really branched off and started doing dry needling as like my niche and my practice. And since here in Texas, and it's not really covered by insurance yet, that's what kind of transitioned me to do like more cash-based physical therapy. So I don't accept insurance. I do all cash-based services. And so I really try to respect my client and not keep them coming back. Sometimes our programs are like 6 weeks to 12 weeks long. I try to treat patients like within 1 to 4 sessions. And so far, so good. It's been, working for me and my clients pretty well.
Okay, great, great. So, what are some of the symptoms someone would come in with that you can treat them with dry needling, and then like, can you give us some results of after the treatment?
Yeah, so I see people from head to toe with dry needling, like people with migraines get a lot of relief. I've treated people for TMJ,
What's TMJ?
thing, the temporomandibular joint dysfunction. So like if you have any type of jaw clicking, if you grind your teeth at night, it's kind of similar what people would get Botox in that area for.
Hmm.
Instead of doing the Botox with the needle and injections, we can do the dry needle and get some of those same results. Same thing with migraines. Sometimes people get Botox injection for migraines. So dry needling kind of came about because when people get those injections like Botox or the steroid shots for their knees or in their back, wherever people get these shots, some of the research was saying that it may be the needle that actually give the relief versus the medicine that's in a needle. So they said, let's try a dry needle, which is a needle without medicine. And that's kind of how that whole thought came about. So I do see some good results that like people might get an injection for. So if people have, so many people have tense shoulders. That's an easy dry needling thing. We're all like this at some
Yeah.
point. Back pain. I treat a lot of sciatica. So yes, I'm putting needles in your butt. Um, knee pain, just any type of pain. I'm, pretty much treating plantar fasciitis, Achilles, anything that you can think of, really.